Hello everyone, my name is Mary Mark. I am here to do my presentation and the topic I chose is depression. I chose depression because it's something that I can say I'm familiar with, although that familiarity is many miles long. Many years ago, I had a short relationship with depression, but today I am thankful that I've never had a recurrence. I had a wonderful counselor, and so here I am. So with that being said, we are going to define depression. So the definition of depression is feelings of despondency and dejection. It is a mood disorder which causes sadness, loss of interest, feelings of guilt, and a low self-worth. It disturbs our sleep or appetite. It disturbs our concentration. It affects how we feel, how we think and behave, and can lead to a variety of emotional and physical problems. So what causes depression? And only by the name depression, we can really get an idea of what it entails. So depression is viewed to be the result of interaction between several forces such as genetics, medical problems, medication, stress, and neurochemical imbalance. Also, the dysregulation of the hypothalamus pituitary adrenal axis is implicated as well. There are three neurotransmitters that is implicated to have some significance in the onset and maintenance of depression. And these neurotransmitters are norepinephrine, which is responsible for energy, metabolism, mood, anxiety, and focus. And we remember this as fight or flight. There is serotonin, which is responsible for sleep cycle, mood, appetite, arousal, memory, impulse control, sexual desire. And this is known as the feel-good hormone. And then there's dopamine, which focuses on attention, memory, motivation, and mood. This picture just gives us an idea of the physical and physiological changes that occur in our body due to the effect of depression. And just to name a few, there are cognitive changes, there are weight problems, there is poor appetite, there's heart attack outcomes, there's feelings of emptiness and hopelessness, overwhelming sadness, and so forth. The different types of depression include major depressive disorder. The symptoms of this disorder includes loss of interest, loss of pleasure, weight loss, weight gain, lack of energy, thoughts of death and of suicide. There is dysthymia, whose symptoms include depressed moods that last for at least 2 years. And an individual with dysthymia may have episodes of major depression along with periods of less severe symptoms. There is psychotic depression, and the individual with psychotic depression experiences severe depression along with psychosis. There's some delusion or false beliefs and hallucinations, which means they're hearing or seeing things that others around them can't. Last but not least, there is postpartum depression, which of course is experienced by us women, and women who experience postpartum depression are experiencing major depression. The extreme sadness and anxiety and exhaustion that they experience with this type of depression interferes with their ability to function and to complete daily activities, both for the mother and for the child. So who is affected by depression? Well, depression is unforgiving. No one is exempt from this pervasive disease. It affects men and women, young and old, irrespective of their race, of their age, of their sex, of their culture, and of their socioeconomic background. It often begins in a young age and is usually accompanied with symptoms of anxiety such as fear, rapid heartbeat, and hyperventilation. It is stated that more women than men are affected by this disease, and more Caucasian women than any other race. Worldwide, there are over 350 individuals who are affected by depression, 15 million of whom are Americans. At its worst, depression can lead to suicide, and it has also been noted that over 1 million suicides occur per year, and this has been calculated to 3,000 suicides per day. The signs and symptoms of depressions include depressed mood nearly every day, diminished interest or pleasure in all or most activities, significant change in weight or appetite, insomnia or hypersomnia, fatigue or weight loss, psychomotor agitation or retardation, feelings of worthlessness or guilt, diminished ability to think or to concentrate, and recurring thoughts of death and or suicide. So how is this disease diagnosed? The tools used in the diagnosis of, oh my word, the tools used in the diagnosis of depression include the Beck Depression Inventory Tool and Center for Epidemiological Studies Depression Scale. The client is given a list of multiple choice questions, and the response to these questions are used to assess the severity and or diagnosis of depression. 5 or more symptoms must be present for at least 2 weeks, and of these 5 symptoms, one of the following must be present, and they are being in a depressed mode for most of the day, or diminished pleasure or interest in all or most activities. So again, one of these two must be present in order to have a positive diagnosis, or must be present in the 5 symptoms. And symptoms must not be related to substance or general medical condition. So how is depression treated? First and foremost, most patients with depression are treated by the primary care physician, except for in severe cases, which would then be referred to a psychiatrist, a psychologist, or another mental health professional. Due to the stigma attached to depression and other mental health disorders, many people, for this reason or otherwise, who are depressed go undiagnosed, and unfortunately some of those who are diagnosed are not adequately treated. With that being said, and with these negatives in place, this means that there is an ongoing cycle of depression. The modes of treatment include pharmacotherapy, psychotherapy, and exercise. Yay for exercise. What is the effect of treatment on depression? Well, the medicine used in the treatment of depression is antidepressants, and they are widely used in the US in the treatment of moderate to severe depression. However, there are unwanted side effects, as with most medicines, and the inconsistency in adhering to taking these medications leads to recurrence of depression. There are 2 different types of psychotherapy. There is cognitive behavioral therapy and there is interpersonal therapy. In cognitive behavioral therapy, the client is helped to identify cognitive distortions or maladaptive thoughts and realize that they are irrelevant, and so they are helped to replace them with positive, more relevant thoughts that are beneficial, certainly for the clients. In interpersonal therapy, the client also is helped to identify interpersonal problems and collaborate with the healthcare provider to create new ones and to adapt to these new interpersonal skills and behavior. The effect of exercise on depression. Exercise is medicine. So apart from the physical and physiological benefits of exercise, it has been noted that exercise and resistance training can also reduce depressive symptoms in patients with major depressive disorder. Okay, so this picture here says that exercise is the most potent and underutilized an antidepressant, and it's free. Excuse me. This one says that exercise boosts our strength. It gives us confidence. Of course, it changes our body image. We get a boost of happiness. Exercise increases endorphins, which also gives us a boost in happiness. And this one says that exercise reduces depression. Yay for exercise. So in my case study, my client is a 56-year-old African-American female. She's unhappy with life situation. She has no energy, is in bed all day, has not exercised in the past 2 years, has really been eating an unhealthy diet, has gained over 40 pounds and is 220 pounds. She's overwhelmed with personal issues. She's experiencing joint pain and her blood pressure is 120/80. Her medical history states that she has dyslipidemia. She has a family history of myocardial infarction. Her dad died at 60, her mom at 70, but her brother at 29. She has a 62-year-old brother who has diabetes mellitus. So the risk stratification for her, since she has four positives, is moderate. Her goal here is to modify eating habits so she can facilitate weight loss, begin moderate exercise such as walking to help lose those pounds, consult her doctor about her pain, and later return to the gym. Okay, so in consideration for exercise testing, I have taken into consideration, even though it's not a health risk, but the fact that she has lack of energy, no motivation, hasn't exercised in over 2 years. She has pain in her knees, pain in her wrist. She is obese and she's very aware of her body image. Nevertheless, one of the best modes of exercise for this client is the treadmill, walking. The exercise prescription I have determined for her includes walking. So the frequency is 3 to 5 days a week to start and later progress to 7 days. The intensity is moderate. The time is 20 to 30 minutes and later increase it to 45 to 60 minutes a day. And the type is walking or stationary bike. Later on, since she has joint pain, especially wrist, the other exercises will be implemented, such as weight training and so forth. And she can use free weights or machines. So in conclusion, what I have found is that depression is an illness and it's not a choice. It affects millions of people worldwide. We are responsible for the stigmatization of depression and other mental health illness and should work at removing that stigma. No one should be ashamed about depression, but rather should seek the resources necessary for health and well-being. If you know someone who exhibits symptoms of depression, reach out to them. Let them know that you care. Provide available resources. Talk to them about exercise and be that encouragement that they need. These are my references, and this ends my PowerPoint presentation. I really do hope that someone is enlightened by this information. Thank you and have a good evening.